Hi. Good morning and welcome to the Insurance and Pharmaceuticals Subcommittee of the Health and Government Operations Committee. Today, we have two bills on our agenda, and we expect to have a discussion about these bills and to vote on them. So we are going to start with House Bill 1232, Health Occupations, Pharmacists, Administration of Vaccines. And I'm going to go to Lisa. Tell us what the bill as amended does here.
So as introduced, it would have permanently authorized a licensed pharmacist to order and administer a vaccine. Under the amendments that were distributed and the reprint that was distributed, instead of making it permanent, it's extending what the current law is that we passed. I think it's been 2 years ago. And it extends that for 1 additional year.
Okay, thanks, Lisa. Delegate Lopez, this is your bill. Are you comfortable with the amendment?
Yes, I am. I know that the study will be helpful, and if it takes a year, then, that's what it takes.
Okay. Is there anyone who wants to speak to this bill or has questions about this bill? Please, if so, please raise your virtual hand. Delegate Morgan.
Thank you, Madam Chair. Just a question on the bill. I mean, to me, this bill's kind of running contrary to what our normal healthcare policy is. I mean, in the state of Maryland, under, I believe, the insurance we have, which is Care First, I mean, we're required to go see well visits. I thought the whole point of getting vaccinated and having it done by a physician was to almost require parents to go see a physician and do almost a well check and be well informed of what their vaccine's taking, what vaccine they're being given, what's being offered, the pros and cons of that. I mean, I understand that we, made these exceptions for pharmacists during COVID, and that was basically a supply and demand deal where we wanted to try to get as many people vaccinated as possible, but we're kind of past that.
Thank you, Delegate. I'm wondering, Kaylee Locklear, would you like to respond to that?
Yeah, absolutely. So we actually included in this legislation a touch to the family, which I don't think is occurring anywhere else. The fact of the matter is 46% of children in this state actually do not have a medical home. So those families prior to this were likely going to the health department or perhaps being immunized in the school system in some way. But that ability and that convenience to take your child to a pharmacist, immunize your child, and then have a conversation with that parent or caregiver, which I know has been a point of contention too, which we can talk about a little more. They absolutely have to be talked with. And then beyond that, we have to refer them to a pediatrician. So this is an additional step to ensure that parents are being reminded of the importance of wellness visits and then actually being referred if they need to be.
So basically what Delegate Morgan was asking for, it will continue.
Yes.
And I just want to affirm what I just heard you say, that there's actually a referral to a pediatrician for
Correct.
Children. Okay, thank you.
Yep.
Delegate Tavares. You're on mute, Delegate.
Yeah, no, I'm looking through the bill. I don't see any issues. My only concern is that, is this at all affected by, I doubt it, but I'm just trying to ask Lisa to verify that this is not at all affected by the fact that owners of the Moderna want to quadruple the cost value of each vaccine administered.
This doesn't have anything to do with the cost. It's just authority for the pharmacist.
That's what I thought. Okay, thank you.
Okay. Pam Casemeyer.
Hi, Pam Casemeyer here on behalf of the Academy of Pediatrics and the State Medical Society. And we would take a fair amount of issue with some of the points that were raised. The 40% or whatever, I'm sorry, Kaylee, I don't know the exact percentage you said, not having a medical home, I don't think is, we haven't been able to verify that information anywhere. And Maryland has always had some of the highest vaccination rates in the country. But when we have Dr. Diamond on the line, even in the language of the bill, it says referral if appropriate. Well, we're not even sure what that means and or how they determine who they refer them to. And the well child visit part of this down to that age. I mean, I want to remind people what we had before COVID and what we were going to be going back to in July. And we got information from this across the 50 states. Very few, if any, have retained this authority. In fact, very few had as liberal a law as we, well, I don't know if liberal is the right way, that's not what I meant. Very few people had statutes in place that allowed administration in a way that we already did, which was down to age 8 or 9 with a prescription from a pediatric provider. And this prescriptions now can be sent electronically. So it doesn't mean you had to go in. If there was some reason that you needed your vaccine before you could get into your well child visit, there was a way to do that. But it ensured that the child stay connected and the services. And if you look at the amount of services and the screening and the medical care that's provided through a well child visit, vaccines are a part of it, but they're, I wouldn't say a small part. We are very, very, very supportive. And it's why Maryland has had and continues to have one of the highest vaccination rates in the country. We didn't have an access issue even before COVID. But now we're creating and extending the potential because there has been a drop in well child visits over this period of time. And we'd like to get back, and so many other policies that you have discussed, continuing to enhance building a broader medical home. You did the collaborative care model. You've got a lot of bills this year where you're trying to make sure you're not fragmenting healthcare. And there isn't any evidence that we're not able to get kids vaccinated. So we're not sure why there's a need to extend the COVID provisions beyond when they are to sunset federally as well.
Okay. I'm going to go to Delegate Kaiser.
Thank you, Madam Chair. I wanted to touch back on something that both Delegate Morgan said and what Ms. Locklear said. If I understand it, Delegate Morgan thought we were going against our practice of well care visits, but if I wanted to make sure I heard correctly what Ms. Locklear said was that there's still a certain percentage of people who don't have those doctors and that the pharmacist is the only access point. So I wanted to make sure I understood those numbers and I could hear them again from Ms. Locklear.
Yeah, absolutely. And I would direct you to two sources of information, either the NIH or the Kaiser Foundation, both of which have publicly put those numbers out. But it's 46.2% of children in the state of Maryland do not have a medical home.
Okay, thank you. That's all I need to know. Thank you.
Delegate Salega.
Thank you. I would like to ask Pam again about the numbers that you all have for MedChi about the number of kids that are still looking for a family doctor or pediatrician.
Yes, so I would say the NIH numbers do not include all of the payer categories, and their definition for medical home is not the same as having a pediatrician. So depending on what your relationship is, medical home has a very narrower definition. So we're not just talking about medical home. There's a lot of people who have pediatricians that they see. Whether or not it meets the NIH definition isn't correct, because when you think about it, everyone in Medicaid has a pediatrician. So there, because that's part of the Medicaid program, and you get rolled in an MCO, and you pick your providers. And so those numbers from an NIH number isn't accurate, because their base for what they evaluated isn't correct. And then so that's a number that we don't agree with. And as I said previously, even prior to COVID, we had one of the highest vaccination rates in the country. We had 90% of our children were vaccinated. So there wasn't an access to vaccine issue, and that number of 40%, we don't find to be accurate.
And so I would say, back to what our colleague Sue Krebs would say, what problem are we trying to solve? And it sounds like, from Pam Casemeyer, we don't have a problem we're trying to solve. I see there's a pediatrician on here. I would love to have him weigh in on the nuances of giving pediatric vaccines. There's a reason that they go to medical school and learn how to treat children, because children are not adults. And also, I would like to point out that there have been documented cases of children being given adult vaccines inadvertently in a pharmacy, where that could happen. If your child is in a pediatrician's office, I think the standard of care, I'm not disparaging my very good pharmacy friends, have many good friends who are pharmacists, but they do not go to medical school to treat children 3 years old. Three is just very low. So if the pediatrician would be willing to weigh in, I'd love to hear his view. Thank you.
Dr. Diamond?
If that's okay, I don't even know where to start, but just to start out by saying that, number one, people who do not have medical homes, as a whole, as a generalization, tend to be disenfranchised and are active in the VFC program, the Vaccine for Children. Pharmacies in the state, to my knowledge, by far and away do not participate at all. And so the argument that they provide care for people who don't have medical homes is a little weak, because they don't provide care to a chunk of those people who don't have medical homes. That's number one. Number two, we have to be real. The reality is the pharmacists are extremely busy. Are they going to sit there through this whole process of discussing with the parents the need for a medical home? They need to find a pediatrician. Here, let me look up the people in the area, et cetera, et cetera. I don't know if any of you have had vaccines at pharmacies, but they barely ask you any questions at all, other than maybe, have you been sick in the last 2 weeks? They don't go over the contraindications or the problems. They hand you a piece of paper. The average person doesn't read it. Number one, or number two. Number three, taking care of children is more than just giving shots. It's a whole slew of things that we look at, and I think there's a need to focus, as Pam said, not fragment medical care. And number four, if there is a catastrophe, in other words, a child has a severe anaphylactic response to the shot, unlikely but possible, I have been trained under supervision on how to provide appropriate care. I have treated not hundreds, but dozens of patients who needed resuscitation. It is not the same as learning on a dummy. And so, we're increasing risk. We immunize anyway, as Pam said, to a high degree. Is there a real need to fragment medical care even further? And the studies show that whenever there's an option like that, It fragments medical care.
Okay, thank you, Doctor. I'm going to take Dr. Delegate Tavares and Jill McCormick, and then we're going to, I'm going to try to close this conversation. Delegate Tavares. Up, you're on mute.
Okay. And I thank Dr. Diamond for his comments. When Delegate Shalega asked what's the problem we're trying to solve, basically it's kids in my district, right? We have an overwhelming majority, over 4% of the school system. And I would say if we're looking at the schools in my area, that's probably, we're talking about 1 out of every 3 to 4 kids is not vaccinated. They're just not. They don't have access to doctors. They don't have access to federally qualified health centers because that's capped. So we just don't have the access. We don't have enough nurses in the schools. So even that option is limited. So this is a viable option for folks in my district. And so this is why this is so critical. There was one time.
Oh, you're on mute. You went to mute.
We had a crisis where we had thousands of children. And this is before COVID, okay? We handle this every year where we have to start educating people, you got to get your kids vaccinated. And I mean, people lost jobs. I mean, this is a serious, serious issue in my district. I can't tell you how serious it is. So I'll leave it there and I'll say this is why this bill is so critical in areas like mine. Thank you.
Thank you, Delegate. Jill McCormick.
Hi, Jill McCormick with the National Association of Chain Drug Stores. Thanks for your time. I just wanted to clarify a couple of things briefly. First of all, pharmacists have been giving vaccines in Maryland since H1N1 in 2008. So in 2009, you changed the law, you allowed pharmacists to give vaccines, and you have built upon that law moving forward. So there is a long history here. It was not just COVID. The second thing I'd like to say is I appreciate Dr. Diamond's position. We do want to work with the pediatric and the medical community, but a lot of what he said was anecdotal, and some of it was just, we are required by law to use the same screening form a doc would use before giving anyone a vaccine, child or adult. So, and I'd also like to just underscore that although pharmacists are not medical experts, pharmacists have a PharmD in medications, in pharmacology. So they are very, very much medication experts, and vaccines are medications. So they understand very, very well what the contraindications are or could be, depending on that patient's health background. So we take very extensive screenings when they come in, the ones that you absolutely need to have so that you can have that particular vaccine. I'd also just say, we did over 3 million vaccines in Maryland in the past 3 years. We've done millions in the years before that. So this is not anything new. If we don't pass this bill, you will not be able to get a COVID vaccine in a pharmacy after the PrEP Act expires because COVID isn't even in statute right now. So I just kind of wanted to go over those couple of things just to level set. And then I just say, given that pharmacies gave 2 out of 3 vaccines across the nation in the last 3 years, is the medical community equipped to do that moving forward if we no longer have this authority? And I'll stop there.
Okay, now I'm going to quickly go to Pam and then to Delegate Kipke, and then we are going to wrap this up. Pam?
The statistics that Ms. McCormick just added in terms of the millions of vaccines, I don't know if those were all children or those were gross numbers for adults and children. And as I said before, Maryland did have a framework which enabled administration for children down to age 8, I think, or 9, with a prescription. So we're not asking that gets eliminated. We're asking we go back to what we had before, not all the way down to age 3. That 3 to 8 is a big difference. But secondly, to Delegate Taveras' comment, pharmacists are not VFC providers. That's Medicaid and uninsured and underinsured. They're not able to, they don't participate. So those children, unless I guess somehow they're coming up with the dollars, are not getting vaccinated by the pharmacies because they're not VFC providers. So there's an access. We talked about in our written testimony enabling the continuation of flu and COVID and any other public health vaccine, and including a requirement that they become VFC providers so that those uninsured and Medicaid recipients could be accessed it if you thought that was the access issue. We don't necessarily agree, but I think that's the population you want to be focused on.
Okay. Delegate Kipke, you are going to wrap us up for this part.
One thing about politics these days is so many people, I don't think, can see nuance in things. It's all one way or the other. And I feel as though that's how this debate is taking place. On one hand, you have people saying that there's not enough children with medical homes, and we have to do this as the solution. But I will challenge you to do a little bit more research on this subject. And I'm glad that there's a study that will look at it, because in all of our districts, children that attend public schools have to be vaccinated. So they're getting vaccinated somehow. And what that looks like might be different for different populations. My district might look different than another district in how they're getting their vaccinations. But you don't throw the baby out with the bathwater and have fewer kids getting well visits, screenings in pediatricians' offices. And I will also say that it's not the best environment to have a little kid, a 3-year-old, 4-year-old, get vaccinated in a retail pharmacy, which in a lot of ways looks a lot like a sweatshop these days at CVS and places like that. So I'm going to move to make an amendment to the bill to exclude 8 and younger, as was Maryland's law before. They can, with a prescription, they can get their vaccines 9 and up. I think there's a sweet spot on this that is medically appropriate and strikes a middle ground. So I'd like to move the amendment, and I'm hoping that somebody here would be willing to second it.
Second.
Okay, it's been moved and seconded. Discussion on this amendment. Delegate Lopez, do you want to take first crack?
I would prefer to keep this bill as clean as possible and keep it as consistent as the current practices are while we're awaiting the study. If the idea is that we need a study to confirm that this is the path forward, I would like to keep it as consistent as possible moving forward.
Okay. Delegate Taveras on the amendment.
I agree with Delegate Lopez. And not only that, I think that there is an inherent assumption being made here that all these kids are receiving Medicaid or CHIP or some other type of subsidies, and they're not. And so that is part of the problem, right? They're really falling through the cracks. These are children that are literally falling through the cracks. So as far as I'm concerned, we need to be able to have as many tools in the toolbox as possible. And this is one of them. And I can say, at least for my experience, they were a critical player in addressing the needs of my community during the pandemic, because we were the most affected. My zip code was the most affected in all of Virginia, DC, and Maryland. Yet we were the last to receive testing and the last to receive vaccines until I had to go to the White House. So please, we need something like this to address this need in the community. Thank you.
Thank you. Delegate Morgan.
Thank you, Madam Chair. Question on an amendment, if the sponsor wants to answer it, or the chairman. So this amendment would take us back to what we did for only like 3 years ago, correct? Prior to COVID.
That's
And-
correct. And it also reestablishes a policy that is consistent with the vast majority of the country.
That was
I
going to
know.
be my second question of how many states are, it seems like the majority of states overwhelmingly rolled back their COVID policy because, I mean, look, we worked really hard on having a uniform healthcare policy and just to make something, change it on a whim because a once in a lifetime virus comes through, seems ill-advised to me.
Okay,
Yeah.
thank you, Delegate. Delegate Kipke?
I'll just say that, having listened to testimony for many years as it relates to healthcare policy and being I have a whole wall of plaques from pharmacists thanking me for trying to help them over the years. And I don't want to stand in the way of adult vaccination in the pharmacy because I think that adults have a better capability and it's a more appropriate environment for certain people. But this is a problem. I disagree with the testimony that this is necessary. It's not necessary for little kids. That is not true. And the research does not suggest that it's necessary. Is it another tool in the toolbox? Yes, I agree with that. But the problem is you will have a reduction in people taking their children to a pediatrician's office because that's human nature. And when you lose that ability, you lose the ability to screen for many things like autism and other developmental delay issues, speech issues. There's a lot of other screenings that go on with little kids, and that's appropriate in a pediatrician's office. And if you don't have enough pediatricians in your district, that's the problem that you need to fix. But creating a system where fewer people get those screenings is not the right policy. Thank you.
Thank you, Delegate. Delegate Shaleka?
Thank you. And well said, Delegate Kipke. I would just like to point to a testimony that we received, all of us on the committee, from a woman named Jessica Helms from Capitol Heights. And she talked about during COVID, her pediatrician's office didn't do full visits, but they did drive-through vaccination when needed. And she talks about her older kids. But then last week, which was March 10th, her 4-year-old was being diagnosed with craniocyst, something that I cannot pronounce, which is a serious condition. And so right now, her 4-year-old is doing fine, but there's concern for her well-being outside of still not being potty trained at 4.5 and other problems that she's having from this condition. And she said that we should not pass this bill. Her family is, the perfect example of why it's important to make sure that our kids, our children get to a pediatrician. And so I agree with Delegate Kipke. We cannot do something that will create a problem where our kids are not getting seen by a pediatrician. And the, pharmacy in many of our pharmacies is not the right venue for 3- and 4-year-olds. So, go back to what we used to do that we knew worked at that point. So thank you.
Kaylee Locklear.
There we go. Sorry. I just wanted to point out that actually only 9 states, including Maryland, do require a doctor's prescription. So Maryland is in the minority as far as requiring a prescription goes. And again, we are not in any way trying to undermine the importance of wellness visits. We view ourselves as a partner on the healthcare team. This is another opportunity to remind families and re-refer them to a pediatrician. That is the goal. It is in statute. And is required by law. And again, I just go back to there are so many areas in this state that are limited resource areas. There are medically underserved populations, at-risk communities who appreciate the convenience of being able to take their child into a pharmacy, and to cut that off after 3 years when every state around us right now is allowing this, it will be harmful. So, I'm glad to answer more questions around that, but really urge this committee to resist this amendment.
Thank you. Delegate Kaiser.
Thank you, Madam Chair. And just quickly, I wanted to ask Delegate Kipke about his proposed amendment at age 8, which really doesn't line up with school ages. Why you picked that age range?
Well, the pediatrician's probably the best person to answer that, but up to age 8 is when all of the screenings for very serious things are looked for in a pediatrician's office, lifelong things that can be impacted at an early age. I believe that's the reason. And I'll just reply. I have I can't share it in the chat. I was trying to do that. The testimony that was given before me isn't totally accurate. Many states have restrictions on youth vaccinations. I have a summary of all the states. There are exceptions because of COVID, but as of 2021, the minority of the states would have a bill like this, a very small minority. Many states, most states have some restrictions for youth vaccination, and I'll email it to everybody, but I can't share it in the chat.
Okay, thank you. Delegate Kaiser, did that answer your question? Okay, we're going to go to Pam Casemeyer.
Just real quick, and thank you, Delegate Kippy, but we can send that information over. In fact, there are a number of states. The COVID PrEP national action was just related to COVID. There are many, many states that don't allow any administration of vaccines to children under 18. Some have different rules. Very few, if any, go as low as this. It was short term, and many of them don't permit it at all. So Maryland actually had more flexibility for access through pharmacies for children than many states did long before the COVID vaccine. So I don't want to repeat what Delegate Kippy said, but I can get you that data as well.
Okay, thank you. All right, seeing no one else raising their hand, I do want to say a couple of things, and that is, first of all, pharmacists are trained to do immunizations. That is part of their training. And in our statute, it's very clear that they have to have that training before they do it. And this, I guess I do not view the administration of immunizations as a barrier to medical homes. In fact, if 2 children in one pharmacy get to a medical home because they went to the pharmacy for an immunization, that's of benefit to those children. So I think that there is a relationship, there can be a team relationship between the pharmacist and the medical homes. I mean, if pharmacists are referring to pediatricians, there's already a relationship there, because otherwise there wouldn't be that referral mechanism. So I just wanted to put that out, and I want to call the vote on this amendment. Those committee members in favor of the amendment, please raise your virtual hand. I see Delegate Solega, Delegate Kipke, Delegate Morgan. Okay. Those opposed to the amendment? Delegate Taveras, Delegate Kaiser, Delegate Kerr, Delegate Bandari, Delegate Johnson, Delegate Zoni, and myself. Okay, so the motion fails. Do I have a motion on the bill as presented here with its amendments, with the motion on the amendments to the bill?
Move the bill with the amendment.
What, you got to move the amendments first.
Move the amendment.
Okay. Is there a second?
Second.
Okay. I think we've probably discussed this sufficiently. I'll give you a chance to speak to it, Delegate Bandari, and then we'll.
Yeah, thank you. I do 100% agree with that will increase the access and it will be very convenient as well and will be cost effective and, and increase the education as well. Pharmacists can also provide education to parents and children about the importance of vaccination and address any concern they may have about the vaccines as well. And they're trained, and I feel comfortable voting for this bill.
Okay, thank you. Those in favor of the amendments to the bill, please raise your virtual hands. Okay. Delegate Kerr, Delegate Gazzoni, Delegate Johnson, Delegate Kipke, Delegate Kaiser, Delegate Bandari, Delegate Morgan. This is in support of the amendments that were presented on the paper today. Okay.
Okay.
All right. So let me go again. Delegate Kerr, Gazzoni, Johnson, Kaiser, Bandari, Morgan, Shalega, Taveras, myself. Okay. Okay. Do I have, so the amendment passes. And now can I have a motion on the bill as amended?
Move the bill as amended.
Second.
Okay, it's been moved and seconded that bill is amended. Delegate Kaiser, did you want to speak to it again, or are you just raising your hand now? Okay. Okay, those in favor of the bill as amended, please raise your hands. Virtual hands. I've got Delegate Kerr, Kaiser, Bandari, Gazzoni, Johnson, Taveras, myself. Okay, so okay, those put your virtual hands down, please. And those opposed to the bill as amended, I've got Delegate Kipke, Morgan, Shalega. Okay, all right, thank you. The bill passes as amended. Thank you very much, everyone, for the discussion. I really appreciate the insights, and we know that we have another year of the status quo. And we fully expect that we will be discussing this in the next session in 2024. And also, we also know that we may have some more information at that time. So thank you all very much. Let's move to Senate Bill 184, Health Insurance, Diagnostic and Supplemental Examinations for Breast Cancer, Cost Sharing. And Lisa, tell us about this one.
So this bill prohibits carriers that provide coverage for diagnostic breast exams or a supplemental breast exam from imposing a co-payment, co-insurance, or deductible requirement for the exam, except as specified in the bill. So this is a cross-file of a bill we already had. The Senate passed it in a slightly different posture, in that they tweaked the high deductible health plan, health savings account language at the recommendation of MIA. So just to let you know, that's already in the bill. And then additionally, after we heard the breast and lung cancer bill, we wanted to study a little bit more the diagnostic image guided biopsies for breast cancer. So there is an amendment that was distributed that will require the Healthcare Commission to study the financial impact of eliminating cost sharing for diagnostic image guided biopsies.
Move the amendment.
Thank you, Lisa. Can I ask the sponsor to speak to it first, and then you can move the amendment, Delegate Kipke? It's actually Delegate Sample Hughes. It's your bill, the cross file of your bill. Did you want to speak to the amendments? And I think I might have lost her.
Oh, no, I'm here. Can you hear me?
There you are. Okay, now I see
okay.
you. Okay.
Yes, thank you, Chair. So just reiterating that the changes that were made in this new version speaks to the fact that we wanted to make sure that breast cancer certainly is and remains a priority, but we have an opportunity here to move the needle on one area of additional, examinations and making sure there's no additional costs there, but at the same time, still explore and understand what the cost is around the biopsy. So we've done our due diligence, and I think that this is the vehicle to get both things done at the same time.
Thank you, Delegate Sample Hughes. Delegate Kipke, you want to move the amendments?
Let's move it.
And do I have a second?
Second.
Any discussion on the amendments? Seeing none, those in favor of the amendments, please say aye.
Aye.
Will there be any opposition to the amendments? Okay, seeing none, passes unanimously. Do I have a motion on the bill as amended?
Second.
Got a motion on the bill. And are there any questions or discussion on the bill as amended? Seeing none, those in favor of the bill as amended, please say aye. And those, will there be any opposition to the bill as amended? Delegate Taveras, I just want to check and make sure because your hand is up. Are you in-
Nope, I'm
You're-
good, I'm good.
You're good?
We're-
Okay.
We're going
Just like-
forward. We're going forward.
Okay. All right, then the bill as amended passes unanimously. Should have started with this bill. Thank you all
Yeah.
very much for being here today. Thank you, Delegate Sample Hughes, for coming. And we have completed our business. The Health and Government Operations Committee meets at 1 o'clock today for bill hearings, and then there'll be a voting session after. Thank you all very much. This meeting